Okay, so for this political talk video, I want to discuss my solutions to the problems with US healthcare and health insurance. And if you've been following me on YouTube for a while, you'll notice some of the things I'm about to say I've posted in comments of various progressive YouTube channels before. I've just decided to put them all together into one video and add on to a few of them. Just because I feel like all these issues, or all these things I've talked about before, combine our solutions to this one key issue. So I'm just going to read off a slight list here I have right behind the camera, so I'll be looking at a slight angle. But yeah, so going to try and keep this one fairly short, although I said that for the last few as well, so... and they still end up, a couple of them being over 10 minutes. But yeah, nevertheless, so... And this is all personal opinion. I've said before I consider myself very progressive Democrat on most issues, though there are a few I'm somewhat moderate on. So this is just my personal opinion on the solutions to all these problems that I feel are very significant, especially in this time we're facing right now with the coronavirus crisis. So, alright, let's get into it. So, first things first, and I've probably said this on YouTube more than any other comment, because I'm not gonna lie, I copy and paste this to a lot of YouTube channel videos. But we need Medicare for all, or some form of a single-payer, universal health care system here in the United States. Because, especially in the time of the coronavirus pandemic, where we've seen over 220,000 people die at the time I'm recording this. And I have to ask, what is more pro-life than ensuring every single person in the United States has guaranteed affordable health care, regardless of their job or social status? Also, if we had access to even just basic health care, we would all have the freedom to live long lives and rarely have to worry about medical bankruptcies. Sure, devil's advocate, taxes will go up for a lot of people, but at the same time, the overall cost of healthcare is going to go down so much, everyone will be paying less, and we'll be saving thousands of dollars every year. You see a slight increase in taxes, but overall, you'll be paying a lot less in money. It's savings that really pay off. Furthermore, if some of us need additional healthcare beyond just Medicare, Medicaid, or other forms of Social Security, we have the choice to get additional health insurance. But for a lot of Americans, just Medicare for all is enough. Finally, if every other developed country on the planet, Canada, Germany, the United Kingdom, France, Italy, Sweden, Norway, Denmark, Netherlands, Switzerland, Japan, South Korea, Australia, New Zealand, that's 14 countries, and there's some I didn't even mention, can all implement a Medicare for all universal healthcare system and save money. It saves their countries money. Sure, again, they have higher taxes, but overall the countries spend less on healthcare than we do because of universal healthcare. Why can't we do the same thing and quote-unquote make America great again for everybody, at least on the issue of healthcare? Oh, and another little thing to bring up. If American citizens die from lacking access to affordable health care, or because they can't afford health insurance because maybe their job doesn't provide it, or because Republicans, in some cases, most Republicans, but there are a few Democrats, believe the government shouldn't provide it because it's not the government's responsibility to take care of the people, then we are failing our country's promise in the Declaration of Independence and the U.S. Constitution to, quote, defend life, liberty, and the pursuit of happiness for all of its citizens, as well as promoting the general welfare, which I view as general basic health care for all of the people who live here. Alright, another thing I bring up a lot, and this is kind of like an add-on to the first part, I firmly do believe that we need to implement a sick leave and maternity leave, or as well as a paternity leave system, program here in the United States for all full-time workers, regardless if they are American citizens or not, and that's important. If you work at least 40 hours a week, regardless what the job is, whether it be just something like just working at a fast food restaurant, or if, say, you're mid-management at some, like, say, I don't know, some clothing store chain, or even a CEO at a big business, it doesn't matter. I feel every full-time worker, regardless of their job, needs to be guaranteed at least 2 weeks of sick leave and 2 weeks of paid vacation every year. And again, going back to all those other countries I mentioned, and some I didn't mention, most of them, if not all of them, have this already guaranteed for their workers, because they realize it doesn't do us any good to have workers who work themselves to death. In addition to guaranteed sick leave, oh, and also, real quick, to go back to something else I just said, if American workers come to work sick, because they don't have sick leave, guess what? They could get other workers or customers sick, which hurts the business Because then you have all these sick people that can't work or can't come in to buy your goods. In addition to the guaranteed sick leave for all workers, we also need to be able to allow both mothers with maternity leave and even fathers with paternity leave, because that's even just as important as maternity leave in my opinion. They need to be guaranteed time off with pay, and that's important, with pay, again, regardless of their job, so that way businesses can ensure their employees at all levels can come into work feeling their best and contributing their best physically, mentally every day, going back to what I said a minute ago. But again, going back specifically to the maternity leave, while I feel this one can be more up to the business itself, I still feel, again, same thing there, at least maybe 2 weeks maternity leave and at least 2 weeks paternity leave for all workers. And again, sometimes there are single mothers, but sometimes there's also single fathers, or in some case, families with 2 mothers and 2 fathers who want to be there for their babies when they're first born. So it should be up to every business to provide that health care and provide them with the necessary leave. Alright, next I want to talk about Obamacare. Now, I'm a Democrat, and I will say Obama wasn't perfect, but I feel overall he did more good than bad. But he was held back a lot by Republicans. And Obamacare is a flawed system because it's based on Mitt Romney's system. But here's the thing. Obamacare, regardless how you feel about it and its problems, at least before Trump became president, because, as president, Trump's been trying to do everything Obama did and make things worse, most Americans would agree. Having any health insurance is better than having no health insurance at all. I'm 25, and in my current job, while they do provide health insurance, I'm still on my dad's health insurance plan because his job provides Blue Cross Blue Shield insurance. And when I'm 26, I'm going to be kicked off my family's plan. So another thing to thank Obama for, pre-existing conditions. I personally don't have one, but still. And also, college students and college graduates can remain on their parents' plans until they find a full-time job that provides it. So yeah, that's good. Having any insurance, even if it's not mine, is still better than having no insurance at all. But of course, in 1 year, I'll be kicked off my insurance plan, my parents' insurance plan, when I turn 26. Also, keep this in mind. As Congresswoman Katie Porter pointed out to some big pharma CEO, I forgot the CEO's name, every member of Congress is guaranteed health care, whether they be Democrat or Republican in the House or the Senate. Every member of Congress is guaranteed a health care plan. But even their health care plans aren't perfect, and she pointed out that our healthcare system is so bad, even they have sometimes worry about how they're going to pay their medical bills. Because, sure, insurance can cover so much, but it doesn't cover everything. And if it's life or death surgery, yeah, it can be expensive in this country, even if you're already in a government job, which is kind of weird. The government can't even put control or oversight over healthcare industries to make sure at least they have good healthcare. So, again, what's the point in having health insurance, or even or regardless of your job or social status, if you could go bankrupt for paying medical bills? And again, medical bill bankruptcies doesn't exist in all those other countries I just said, because even if you have bills, you can pay for them out of pocket. Paying for healthcare to the point where you're so worried about it, or having to worry about paying healthcare to the point where you could go bankrupt, is just insane in the rest of the developed world. And I want to give another personal story real quick. A couple years ago, my mom needed foot surgery. She was having some issue with her foot. And even though, again, we're on Blue Cross Blue Shield insurance, the surgery would have cost about $3,000. But that's with insurance. Without insurance, it would have cost about 12 times that, at almost $40,000. Thankfully, my mom, she decided to hold off on getting the surgery at the time, and eventually her foot got better. So, because it wasn't that big of a thing, I think she got sprained or something and just needs slight surgery to put it back in place. I don't remember the whole story. But yeah, at the very least, that was minor injury. But here's the thing. Imagine how many people need that surgery, even more serious surgery, and they can't just hold off until they can afford it, or until hopefully it gets better. It's just insane that people will hold off getting surgery or getting medicine because they can't afford it, and then that could lead to their deaths. And finally, this is my last point, and I'll end with this. And this is part of where me that's slightly moderate comes back in. So, I believe it was David Doyle, the YouTuber from the channel Rational National, pointed this out a year or two ago. He said in one of his videos, if a Canadian politician, because he's Canadian, said, let's change our healthcare system to be more like the United States is, they would be laughed out of office. Because even the most conservatives in other developed countries realize our healthcare system, regardless of its flaws, is still better than the US's. We'd be insane for wanting to go to that system. And yet politicians, particularly Republicans, but even some Democrats, constantly support horrible healthcare policies and defunding Social Security, Medicare, and Medicaid because it's like, it's not that big of a deal. But yeah, it is a big deal. Life or death. It's literally life or death for a lot of people if they don't have good health insurance. And additionally, going back to specifically Social Security, when programs like Social Security were introduced in the late 40s to the mid 60s under presidents like Truman or Franklin Roosevelt, Truman, Eisenhower, Kennedy, and Johnson, they all enacted these programs, but back then, the average life expectancy was maybe around 70 years or so. So if people retired at 65, they'd be on those programs for maybe a few years, decade or most. But now the average lifespan for American is closer to 80 years. So people who are on these programs are on them for much longer. And again, part of this is the whole modern in me coming out, thinking, maybe we should up the age for these programs to maybe 70 years old. After all, we still keep having people who are working to their 70s anyway, and if they have a job that provides health insurance through their job, they don't need to go on Social Security, Medicare, Medicaid. But yeah, I still support Medicare for all, but just, I feel like for certain Social Security programs, maybe we should up the ages a little bit. But even then, we still need Medicare for all to take care of all of our citizens, regardless of their age, social status, their job, you name it. So, yeah, overall, those are my solutions to the problems with U.S. healthcare and health insurance. And if this is just my opinion, and I hope one day if I get the opportunity to run for Congress, I can help fix this system by enacting these policies I've laid out throughout this video. If you like what I had to say here, please like the video, share your comments below. If you disagree with me, please explain why you disagree with me and why you think my ideas are wrong, or why you support the system we have now. And if you're watching this video and you're not an American citizen, and I left something out about one of your systems, please let me know, because I'd like to learn about, I'd want to be more informed about how our system is flawed and how we can make it better. Alright, that's all I gotta say. Have a good day. Take care.